How lean management increases added value and helps to identify waste. This is Steve. As an office employee, he is part of a large team, and he works on many different tasks every day. He wants to finish these on schedule and with the required quality. After all, it's important that the customers, in-house or external, are satisfied with the results. But it's actually not that easy. His day is always extremely packed, and even though he tries hard to complete all his tasks, at the end of the day, many of them are still unfinished. Together, Steve and his colleague Claire consider how they can improve his daily schedule. Claire has an idea. She is already familiar with the lean management concept from the manufacturing areas and knows that reducing waste in processes improves efficiency and adds value. First, Steve must find out what his customers need, at which time, and in which quality. Here, he notices that many of his daily tasks don't serve the actual goal. What is the best way for them to proceed? Steve and Claire analyze his daily schedule to identify the different types of wastes. Lean management distinguishes between 7 types of waste, and in the morning, Steve already discovers the first, overproduction, because he prints a report multiple times. Then he notices that 2 additional reports that have the same type of information are designed differently for each department. That doesn't make sense and is a typical example of overprocessing. For 2 of the reports, Steve also needs some important signatures. However, the people who must sign the documents are in different meetings, which means that Steve has to wait. Waiting time. When the reports are signed, Steve has to take one last look at them. He checks the contents and counts the documents, including the copies. This is known as the waste type, motion. Afterwards, he takes the different reports straight to the target departments. For this purpose, he has to cross the entire company premises. This waste type is called transport. Almost done. Steve and Claire finally deliver the last report. Unfortunately, they discover a serious error, and everything has to start over again. Defects are also a waste type. And because this effort causes him to neglect his mailbox, the amount of unread emails has drastically increased, well known as inventory. Steve is surprised. He didn't think they would find so much superfluous work. Since he now knows what his customers need, he can identify, eliminate, or reduce the amount of wasteful activities within his tasks. He and his team can now work more efficiently, waste fewer resources, and deliver the best.
Patente. Healthcare in New South Wales and worldwide is changing. Our population continues to grow, technology is advancing, and health costs keep rising. The needs and expectations of patients, carers, healthcare providers, and the community are also changing. Value-based healthcare will help us to address these challenges and provides the opportunity to do things better in New South Wales. Value-based healthcare means continually striving to deliver services that improve health outcomes that matter to patients, patient experiences of receiving care, clinician experiences of providing care, effectiveness and efficiency of care. These are known as the 4 essentials of value. Let's explore what value-based healthcare looks like for a patient and healthcare providers. Meet Wendy. Wendy is living with 2 chronic health conditions that impact her daily activities. When Wendy gets sick, she visits her GP. Her GP coordinates her care and supports her to access the right specialist care when she needs it. This helps to keep Wendy well, which means more time at work and at home with her family and friends. We know from our surveys that patients generally have a better experience of care when it is delivered in outpatient and community settings. Wendy's GPs, specialists, nurses and allied health professionals have a better experience of providing care because they're connected and feel more confident to support her by working together. The health system and Wendy also avoid unnecessary and costly hospital admissions. Of course, if Wendy is very sick, the emergency department is there for her. All New South Wales health staff have a role to play in thinking about value-based healthcare. Clinicians need to ask, am I providing care that's going to deliver the outcomes and experiences that matter most to this patient? Services need to consider, are we using available resources optimally to improve outcomes? And at the system level, we need to consider if we are allocating resources and creating environments that enable the best outcomes for our community. The journey to value-based healthcare is a long-term commitment, but we are developing structures and tools to help us on the journey. If we ask the right questions and use the data, tools and evidence available to us, value-based healthcare will start to become business as usual. Together we can work towards New South Wales Health's vision for a sustainable health system that delivers outcomes that matter to patients and the community, is personalised, invests in wellness and is digitally enabled. Visit the New South Wales Health website to learn more about value-based healthcare in New South Wales.